when I have a person come in and we've been doing all the right things and we still feel like they're stalled, I'm like, let's look in your mouth. Let's just start with a basic like definitions. A cavity is when there's a break in the enamel and there's a decay in the tooth itself. So the dentist will go in and numb us up, clean it out, and then fill it in. Back when I was young, they filled it in with silver amalgam fillings, which they're silver. Now they use ceramic or porcelain. They're much less toxic. A cavitation is different. A cavitation is an area under the tooth in the bone that has literally been eaten away by something or other. Most cavitations form underneath where a tooth has been removed. A lot of people, like me, had their wisdom teeth removed, even though I had orthodontia in the 70s. They didn't do palate expanders. They didn't do anything to open up my mouth, and my teeth are genetically large. The first thing they did when I got orthodontia is they took my bicuspids out just to make room for my teeth to move. I got braces the first time. I think I was like fast forward, I get into my late teens and my wisdom teeth are trying to come in and they were impacted. So I had them taken out. For the most part, where cavitations will form is those areas where there used to be teeth. Now there's a space there. It has to heal over. If any bacteria gets trapped in there at all, then that area of the bone will start to break down. When you eat a chicken and break the bone in half, you can see that the bone is hard on the outside, but on the inside, it's hollow. And the hollow is this mesh-like area. We're always making new bone. That's why if I broke my wrist, it wouldn't stay broken for the rest of my life. There's these cells that come along and they chomp up the old cells. There's a different kind of cell that comes along and lays new bone down. Our bone is always trying to turn over, but if it's not able to turn over in the right way, that's where that mesh-like area becomes wider. There's more hollow spaces, and then it becomes weaker. Bacteria will actually form this goopy, oily gunk that is in there. This is all hidden. You cannot see it with a regular x-ray. The only way to detect these areas of cavitation is by using something called a cone beam, which is basically a tiny little CAT scan of your face. Usually they take a picture that shows the sinus area, the mandible, and the maxilla. And that's the only way to see it. Most dentists aren't educated that way, so they don't know to bother with taking anything other than the kind of x-rays that we're used to seeing. The challenge with these cavitations is, like I said, where there's this breakdown in the bone in these hollow spaces, not only does bacteria get trapped, parasites can get trapped, other pathogens can get trapped in those spaces. They can create this low-grade underlying infection, disruption, low-grade inflammation, disruption in the whole body processes. One research article that I read showed that 70 to 80% of all disease starts in the mouth. I have two acquaintances who are biological dentists. Spoke to one, and then a couple months ago spoke to the other one personally. And they're like, this is like the end all be all. We fix this, and the whole body then is able to heal because we've got this underlying low grade inflammation, low grade infection that just perpetuates. Like I said, if I'm trying to help someone heal their thyroid or trying to help overcome their chronic autoimmune or whatever, and we're getting nowhere, look in the mouth. If we don't go looking with the proper diagnostics, then we're just not going to see them. It really, really negatively impacts a person's health in the long run. It's a pretty big deal. And it can be a real game changer in someone's health. Try not to be overwhelmed with all the information. Take it one thing at a time. And
Yeah.
always reach out. If you have questions, that's what we're here for.